This is Abia COVID-19 update.
Abia COVID-19 update.
Nigerians are assailed daily with troubling images and videos of people traveling across different states in the country in clear violation of an interstate travel ban. The ban is to help halt the spread of the novel coronavirus, and the massive movement of travelers across the states, mostly smuggled in trucks carrying food items or livestock, is a drawback to the COVID-19 containment effort. One of the sure things about the pandemic is that as long as people keep moving, the coronavirus keeps spreading. And the interstate movement of Nigerians, despite the ban, could also be said to be an indictment on the integrity of the nation's security system. Rivers, Akwa Ibom, Abia, Ondo, Bayelsa and other states have turned back people hiding in trucks which carried cattle, goats, rams, yams, bags of rice and cement, and there is also a massive movement of commuters to Abuja from neighboring states. This is Abia State COVID-19 update, the last edition for this week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as the Abia State Governor, Dr. Ikpeazu'S efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, Mondays through Fridays, on several radio stations in the state. On BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. To date, more than 4.5 million people have been infected and over 303,000 have died from COVID-19, and about 1.7 million people have recovered. The United States remains the most hit country. Coronavirus has spread to all the 50 states in the United States. More than 1.4 million cases and 86,000 deaths have been confirmed in the United States. Nigeria recorded 193 new cases of COVID-19 as the number of infected people exceeded 5,000. 3 people also died from the virus yesterday, according to the Nigeria Center for Disease Control. With yesterday's figure, the total tally of infected people in this country rose to 5,162. A breakdown, the details showed that 4 new cases were reported in Imo State, that's the neighboring state here. And of course, Nigeria has so far tested 30,657 persons since the beginning of this pandemic in the country. Of that number, we have 5,162 infections, 3,815 cases are still active, 1,180 have recovered, and 167 deaths have been reported. Now, this morning, we're taking a look at the structures put in place by the governor's Dr. Ikpeazu'S administration that is helping in the fight against this COVID-19. And of course, we will continue our update concerning the COVID-19 in the state as we have the Honorable Commissioner for Information, Chief John Okiyekalu, as our guest this morning, and also the state epidemiologist, Lady Peace Nwogugu, very much in the studio to bring us up to speed on the happenings concerning the testing, what is happening concerning the one active case that we have in Abia State. Honorable Commissioner, you're welcome.
Thank you very much, Mike. Good morning, wonderful people of Abia State.
And also, Lady P, good morning to you.
Good morning, my brother, and good morning, Abians. You're welcome to the program.
All right, I will start with the Honorable Commissioner. What were the structures put in place by the Ikpeazu'S administration before now that helped the fight against COVID-19?
Thank you, Mike. I want to start by once more thanking our frontline workers, the medics that are taking care of us, risking their life daily to ensure that we are safe from COVID-19. Regarding your question, I think Governor Ikpeazu is one governor that this particular pandemic exposed the fact that he was prepared for leadership. The governor has engaged at different levels using his personal experience and training. Of course, you know he's a clinical biochemist. He understands the pathology of this infection, understands what needs to be done. In fact, I recall that it was early in January, before the virus came to Nigeria, that he started discussing what we need to do, assuming it comes to Nigeria. If you notice, the coronavirus interministerial committee in Abia State was set up almost the following day after the virus came to Nigeria. That's the oldest interministerial committee in the whole of this country. It was set up before the presidential task force was set up. The governor has always been leading. Let me start by looking at three axes of response to the virus. One will be sensitization involving information management. The other axis will be healthcare infrastructure in the state. And then the third one will probably be social security or food security, as the case may be. With information management, if you notice, in the past 1.5 years, we've made concerted effort to improve the broadcast quality from BCA. That station was digitized under the administration of Governor Ikpeazu'S. Today, for the past 28 years, after 29 years, BCA is set to join the national grid. He speaks to a governor who understands why it is necessary to have the right systems in place to disseminate information. In combination with the other private radio stations in Abia State, you will see that BCA has engaged extensively in the task of sensitizing our people, informing them concerning this virus. If there is one thing I say without fear of contradiction, it is that there is no living person in Abia State who has not heard about COVID-19. And that's because of the effort we've put into it. And the governor led the charge himself with his jingle, one of which you played previously. And if I wonder what we would have been doing now if he hadn't done that. I mean, fix BCA to the level where it is now. I wonder how we would have been running Helter Skelter. Because, of course, you know, even our radio classroom program is anchored by that station. And because of the reach of BCA in particular, people are able to learn from homes in faraway locations like Aruchukwu, Umunochi, Okwa West, etc., etc. Now, that's as it concerns information dissemination. Looking at healthcare infrastructure, it is like everything the governor has done before now. All of them were geared towards this moment that we are in. For instance, you now know that the ambulances we are using for the medical interventions were procured and provided by the Ikpeazu'S administration. In fact, in 2017, the governor launched the emergency medical response system, where he procured 3 mobile clinics capable of treating people on the go from any part of Abia State. Today, we are using those mobile clinics as part of our intervention infrastructure. Lady Peace Wogu and her team, they have made interventions, visits to Aruchukwu, to Umunochi, to Okwa West, all over the state. That's because we have enough ambulances to ferry as many people as possible. Of course, we are grateful to people like our brother Nana Nwafo, who procured 1 more ambulance and donated to the state. We appreciate Professor Greg Ibe, who put his own ambulances to use for us. They are available, but I'm not sure we've had to use them. That is because the 8 ambulances provided by Governor Ikpeazu'S, they are actively working right now. And we have not been overwhelmed so far, and we are hopeful that we will never be overwhelmed. Still looking at the medical infrastructure. In 2018, Governor Ikpeazu'S launched the first of its kind telehealth facility in Africa, not in Nigeria. People were laughing at him, dial a dog, blah, blah, blah. Today, we have the most robust contact center in the whole of the Federation. People tell me, oh, I've been calling the National Intervention Line, the NCDC line, I can't get across. And I said to them, call 0700-2242-362 and help will come immediately. And that's how it has always been. We were on air when we demonstrated it in various stations. The anchors called, found the system to be robust. medical doctors on 24/7 calls. We have even progressed it. We have now launched a medical app. For those of you who are able to access the internet, you can sit down at home, speak to your doctor face to face using that app. He will make the correct diagnosis and give you what you need to take as drugs. That is for situations that do not require face-to-face visits, surgeries, and so on and so forth. So you see, that infrastructure put in place by Governor Ikpeazu in 2018 is driving a major aspect of our response today. It is helping us to mine information, and it is helping us to protect healthcare workers. Sometimes I wonder, assuming we didn't have that infrastructure, it means that those who suspect that they have COVID-19 will stream into our hospitals to see doctors first. And that would have been very deadly. But because we have that infrastructure in place, they make calls, we send ambulances, send the epidemiology team, the rapid response squad, they go there, advise, review, take samples, and begin the management process from there. For those who will require isolation, those who will require further treatment, of course, they have ambulances at their service that can help move such persons to our isolation centers in Umuahia or Aba. That is another facility that Governor Ikpeazu put in place that nobody is talking about. Looking at the equipment required to fight this, at the beginning of this virus, every other person who had a social media account was talking about ventilators. For us in Abia, we were not worried, because in 2018, as part of the medical equipment Governor Ikpeazu donated to FMC, Umuahia, and Absolute Aba, we had ventilators, we had patient monitors, we had ICU, complete ICU sets, we had beds and beddings that are mobile. These are the same thing being used for this intervention. Beyond that, he has even procured more ventilators. In fact, we were ready to deploy state-owned ventilators at FMC to further support the patients there. But to the glory of God, I'm happy to report that the first patient was discharged without requiring ventilators. The second patient does not require ventilators. Indeed, she has stopped using respirators. Her oxygen management level has improved drastically. She is even moving about, and we're very hopeful that very soon she will come out of isolation. But nobody is giving Governor Ikpeazu credit for that. But he did it. We were able to train our medical workers before this crisis hit us. Lady Peace was part of the training. Early enough, she traveled to join the training at the national level. At the right time, we brought the training home, trained workers from both the state and federal. By the federal, I mean FMC staff, medical staff. The governor sponsored that. And I wonder, what if we didn't do that? At the same time, using the telehealth leverage, we trained all those manning our 772 primary healthcare centers long before COVID-19 came to the southeast, not even to Abia. And nobody is acknowledging the fact that it was this governor that ensured that those 772 telehealth centers were coordinated, able to link up to the telehealth facility to get directives, instructions, support. And indeed, they were adequately trained to identify who will require that kind of support and indeed to protect themselves.
Well, we need to go for a break now, Honorable Commissioner. If I allow you, I know you would go on and on.
Because I still want to tell you, even in social
security,
security, what this governor put in place that has helped us.
But we need to take Lady Peace also to bring us up to speed on what is happening concerning COVID-19 in Abia State. She is the state epidemiologist. We'll go for a break now. When we return, we also turn our direction also to the Lady Peace to give us an to bring us up to speed on the happenings concerning COVID-19. As it stands now, we've recorded 2 cases, but one active case, as the other case has been discharged, medically managed and also discharged. It is Abia State COVID-19 update. It's live on several radio stations in the state.
This is Abia COVID-19 update.
Abia COVID-19 update.
It is still Abia State COVID-19 update live on BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and also Real FM. Buzz FM and Real FM are both in Aba. And I need to let you know that it's 1 month now that we've started this program, and we are grateful to our producers from our partner stations, Samson Eze of Flow FM, Obina Odowike of Real FM, Stanley Mba of Buzz FM, Chine Zerem Agbakuru of BCA. And of course, for you also being part of this program, are sponsored by the Abia State government through Dr. Okeze Victor Ikpeazu. We still have the Honorable Commissioner for Information very much in the studio, bringing us up to speed on the structures put in place by the government in the fight against COVID-19 in Abia State. Yes, Honorable Commissioner.
Thank you, Mike. Most of our palliative intervention was done with Abia rice. A lot of people have forgotten that this governor, early in his administration, made interventions to improve the production of Abia rice, established 4 cottage rice mills that helped us. In fact, in the middle of that palliative intervention, we ran out of rice, and we had to just call Pastor DK of Bende, and immediately we received 1,000 bags of rice, and we continued the intervention. His promotion of Made in Aba is legendary, but not many people realize that without the challenge he threw at our manufacturers in Aba, today I won't be wearing this face mask. Probably this country would have been running helter-skelter to import face masks. Mike, I'm happy to inform you that Abia State government rejected imported face masks from China. We said we do not need them. Federal government can keep them. Nobody should give us face masks. Nobody should give us PPE because our people are making them. Come and buy from us, and we are ready to sell in millions. That is, if the federal government wants us to produce 10 million face masks, we are ready. The systems are already in place, and all because there is a governor who, right from the inception of his administration, has been promoting Made in Aba. And then, if you look at Tenera palms, see, there is no other way out of the post-COVID-19 economy except agriculture. Today, those Tenera palm seeds, the 4 million of them that Governor Ikpeazu planted starting from 2016, they have all started maturing. This will survive us in the next 3-4 years in this state. Same with the Abia rice that we are currently distributing fresh palm seedlings to the people. Mike, let me inform the people of Abia State that the governor has given directive that 1 cottage oil mill be established in each local government, additional 4 cottage rice mills to be established in Aruchuku, Bende, and Umuahia North. In Aruchuku, we already have the Abam rice mill. In Isukwato, we have the Acha rice mill. In Bende, we have the Uzuakoli mill and the Bende mill. And in Umuahia North, we already have the Ofeme mill. But the governor believes that we are likely to have improvements in yield in the coming year. So we need to now put in place those rice mills to mill rice for us so that we'll be food sufficient in Abia State. Permit me to stop at this point and allow Lady P to...
Okay. All right, Honorable Commissioner.
Thank you.
All right, Lady Peace Nwogogo is still very much also in the studio. She's the state epidemiologist, and in terms of response to COVID-19 emergency, she will be the first person to to get across to anyone that put a call through to the Abia State Telehealth Initiative or NCDC numbers, the toll lines here in Abia State. And she has been I think it's more like a war front now, so we want to have an idea what is happening at the war front.
Thank you, Mike. I think God has been helping us in this fight.
Okay.
God has been hearing the prayer of our governor, because initially the first press briefing he held, he prayed that this virus will not be that God will help us fight this virus, and God has been hearing that prayer, because I believe that his leadership is backed by God, and God has been helping us. Our little efforts that is backed by this governor's efforts has been yielding a lot of improvement. There is a lot of good things coming out of it. Our case at FMC despite the underlying elements, despite the age, is doing very well. All we are waiting for is for her to have a negative test result, which we are expecting before end of today is Friday. Maybe by Monday we'll be able to discharge her from isolation ward. For the other things, God has been helping us, and with the
issue of tests, sending samples now. You know, initially we sent samples from Abia to Edo State. Later we had the Abakaliki. Now we have a new one in Imo State. I don't know if you're aware of that.
We are aware, but that one is private. But currently we
have to pay for that if you have to send samples.
We don't even know about that one. We've not gotten the signal to start sending our samples to Imo State. We still send to Abakaliki currently.
How many samples have we sent? If you have an average of the samples sent so far from Abia.
So far we've tested 138 as at late yesterday, and we have 18 samples pending in the laboratory
that
results.
Are yet to we're yet to get the results.
Yes.
So hopefully they will return negative. Let's get a reaction from our listener this morning. It is exactly 1 month of this program. I'm going to thank the producers again from the partnering stations while I'm wrapping up things here this morning. 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289. Hello, good morning. Good morning to you.
Good morning. Good morning, Michael.
Good morning to you. What's your name?
Yeah, this is Roman the Prophet.
You're welcome.
I want to use this opportunity to thank the Commissioner for Information and the lady in the house. I always say that the COVID-19 task force of the presidential team should go of how other states COVID-19 task force team are doing their own things, because they are doing it in a way that is not. You will see the unity of purpose in them. So the only thing I really want the other state COVID-19 to do is to help us give palliative to churches. Please go through PFN and GAN so that those ones that are not gotten will get their own. So at the end of the day, people will still rejoice and say, well, even if it is half up, we still enjoy it.
All right, Loman, let's allow others to. Thank you very much. Good morning to you.
Good morning, sir.
You're welcome. What's your name?
Okay, my name is Ambrose.
Okay, where are you calling from?
I'm calling from Umaya.
Welcome, Ambrose.
Yeah. I want to thank our governor and the Commissioner for Information for giving us all the necessary things to guide this COVID-19. I really want to thank them once again. And the information and leading and other things that have been doing for us to survive this campaign. I really want to thank them. And God bless them.
All right.
Thank you very much.
Thank you for your contribution. Hello, good morning to you. We lost that. We've come to the end of the program for today and the last edition for this week. Right here on Fluid 94.9 FM, Buzz 89.7 FM, Real 99.1 FM, BCA 88.1 FM, Vision Africa Radio 104.1 FM. And many thanks to the Honorable Commissioner, Chief John Okiyikalu, for being part of the program this morning.
Thank you, Mike. Our own test center should be ready within the next 3 weeks.
Okay.
On palliative,
that's wonderful.
We are continuing the process. Some PFN members have received, aside from the big churches that we started with, but that process will continue. Today we are giving to students that are stranded within the state as a result of the lockdown.
Okay.
So please assure Loman, my friend, that we will come to his church very soon.
All right. It means we will be able to test for COVID-19 very soon in Abia State.
Maximum 3 weeks by the grace of God.
All right. Interesting. That's a good news. Lady Peace Nwogugu.
Thank you very much. Please, my people, keep safe. Don't spread the virus. Abide by the rules. Thank you so much.
And like I said, it's 1 month now that we've started this program, and we're grateful to our producers from the partnering stations. Samson Eze of Flow 94.9 FM, Obina Odowike of Real FM, that's in Aba 99.1, Stanley Mba of Buzz FM, also in Aba 89.7, Chinezerem Agbakuru of BCA 88.1 FM, and Igwe Donald of Vision Africa Radio 104.1 FM. Many thanks for being part. The program returns on Monday, where we bring up another issue as far as COVID-19 is concerned in Abia State. My name is Michael Oni. Stay safe and take responsibility.